5 minutes, so I'm going to speak of only 4 things. One thing I did more of is minimally invasive surgery. As we all know, discectomy in 1980 was this, but today these are smaller and smaller holes. And these sort of hideous sort of soft tissue damages are now just done through a small hole, and we use a microscope. I use a microscope for nearly all the surgeries, and I'm not going blind. We put percutaneous screws very, very easily now. It's a very short thing, and these are old pictures now. Just 4 small incisions, and we fix it. We use these tubes, which are elegant devices to get you down to the spine without soft tissue damage. And with this, we can now do simple things like discectomies, complex things like decompressions, and now we can do TLIF, which is the workhorse operation for the lumbar spine. And these TLIFs are done, again, through minimally invasive approaches, without damaging the muscles, without damaging the soft tissues, through retractors such as these. So the previous big incisions and big scars now are more and more going towards these. So MIS surgery, we try to push the envelope. We started doing revision spines, so we don't have to open the midline. We can just go from the side and revise the spine without opening the scar tissue. For metastatic spines as well, where the radiotherapists want to give the radiotherapy as soon as possible, if you use percutaneous screws like this, you stabilize the spine, but there is no soft tissue damage. There is no wound to heal where they want to give the radiation, and this patient gets radiation from the next day of the surgery. We can do multi-level surgeries, whether it's 2 levels or multiple percutaneous screws to fix even longer things, and all of this can be done without damaging the soft tissue envelope. Osteoporotic fractures with instability as well in these elderly group can be fixed with short segments and cement. TB spine, you can debride, you can fuse, all through extremely small incisions, again, without much damage, and even longer segments like this, which you can do by just putting percutaneous screws and tubes. In the cervical spine, now we can go from the back, and radiculopathies, even small tumors, discs can all be removed by just using these tubes and directing yourself directly towards the lesion and then using a microscope to get in there. So basically, mini is sexy. Everybody loves it. Everybody loves mini skirts. We saw the banquet yesterday, and mini is sort of here to stay and is the way of the future. It is still the way of the future. Today, for many indications, it is as good as open. We are not quite there yet for everything, but we are getting better and better at it. And tomorrow, we can do more and more. One thing I did less of is this operation, which is the vertebroplasty. We loved doing it, and we were enthralled by the early results. We got our patients sitting up and smiling the next day. And there was great enthusiasm until this paper came in the NEJM, which everybody reads, especially your treating physicians. And there were these 2 papers which were very high quality, randomized, double-blind trials. 2 papers simultaneously published, which compared vertebroplasty with sham procedures, and they found out there is no difference. And in 2018, again, at 12 months, there is no difference in the results. Then we started seeing complications like adjacent level fractures, other level fractures, good early results which went down to cement breakage and fractures around the vertebrae. And a lot of these patients were then miserable in the long run because of a variety of complications. Most osteoporotic fractures heal, and vertebroplasty had long-term problems. It looks like great fun initially, but when you follow up your patients, they don't do well. The issue clearly was bone density, and from doing 2 or 3 a month, I now do hardly 1 or 2 a year. There are other newer technologies like imaging, navigation, robotics, O-arms, endoscopes, ultrasonic drills, approaches. I would take sort of half a day to talk about these. But what's important is that technology and techniques keep growing by leaps and bounds. Yet, I do not see patient outcomes improving at the same speed. We are doing better than we did around 25 years ago when I started my journey. But why does improved surgery not translate into improved outcomes? That's because spinal disorders have a natural history which is very complex. There is a lack of correlation between imaging and symptoms, and the biomechanics of the spine are too complex to be simplified into simple devices. And very important is most of the symptoms in the spine come because of patient personality and psychology. Hence, what's new in 22 is what's old and gold. That is good patient selection, adequate conservative care, rational surgery, and an honest and ethical practice. That's the only thing which is old and which is new. So finally, Dr. Tanna, I told you we had to include COVID. What COVID has taught me is a simple thing and pretty obvious. There's more to life than spine surgery. Spend more time with your family. Spend more time with your friends. Do the things which you like to do and sort of have fun. Don't be ashamed about it. And more of everything which is fun, whether it's Netflix, good food, or good-looking friends. So I also learned a valuable lesson when my best friend showed me the value of life and living and how your life is just on the edge and how to get back from the edge into real life. And to all of you, I wish cheers to 2022 and the good years beyond. Thank you.